Welcome, my name is Stefan Hartman, and welcome back to Scamdemic, a history. We're going through my Instagram stories over the years. You can see part 1 and part 2 on my Rumble channel, because it'll probably get banned on YouTube, maybe get censored on Instagram too, we'll see. And we are at week 279 weeks ago, which is July 20th, 2020, so really early on in the pandemic. So what was I posting back then? Let's see. 250,000 to 440,000 people die every year from medical errors. I heard hospitals are not allowing family members to go with patients or visit them. Really? I'd like to see a hospital try and stop me. Yeah, this was back during the hospital protocols following the CDC. And I actually heard that today, actually, from a managerial type total state Fox totalitarian, how they're following CDC and hospital protocols to make sure all of their students are vaccinated in their program with the flu vaccine. Like, so these people still exist, and they're the managerial totalitarian state types, right? So it's different from what we're used to. We think of the Soviet Union, of Nazi Germany, of totalitarianism. That is brute totalitarianism. That is the lion type. We have a different type of totalitarianism in our current society in the US and Europe, and it is the bureaucrat totalitarianism. It is the managerial class totalitarianism. And these people use a soft form of coercion. They're not going to go out and shoot people in the streets, put them in gulags. No, they hold degrees from people. They don't allow people to get certain jobs, go take certain tests. They are in positions of power. They've managed to get themselves in there. And they don't need any sort of great orchestra or Illuminati to direct them. They're just following this left-leaning trajectory of politics, which is ever so inclining towards this soft totalitarianism. And it's very hard to beat. And we saw in the pandemic, it was obvious. And maybe they pushed it a little bit too hard there and people pushed back. The soft totalitarianism is very subtle and nefarious. But we're going to go through the history here to learn from the past and how we can change it in the present too, ongoing, to fight back against this soft totalitarianism. Okay, next one. Bro, where is the best place to do an antibodies test? So this is back when I was a little bit more mainstream medicine and I didn't believe so much in blood antibody testing, blood antigen testing for detecting pathogens. This was a pretty novel technology back then. And I've now come to the conclusion it's probably the better way to test for pathogens rather than PCR testing or urine mycotoxin testing. Blood IgG, so testing the body's own immunoreactivity to the pathogen, is probably the better way to test, for example, mold, Lyme, EBV, you name it, these stealth pathogens. You can test the body's own immunoreactivity to it rather than testing for the pathogen itself, because these pathogens are very sneaky and they evade the immune system, they evade testing, and so very difficult to test for. And we can also do lymphocyte map testing, which is a very cool test. So we can look for memory T cells and T lymphocytes and natural killer cells. That's with Cyrix Labs. Brilliant tests. If masks work so well, then how come family aren't allowed to visit the patient in the hospital? Just wear a mask, right? I again was arguing with a managerial state type recently about how if you don't take flu vaccine, you need to be masked up with an N95. The whole mask thing is ridiculous. We saw it argue to infinitum in the pandemic, and still to this day. When I worked for a spine surgeon, yes, we would wear a mask. So I got this argument all the time. Well, you wear a mask in surgery, right? Yes, we wear a mask in surgery, but we don't believe in them. You know what we did in open spine surgery? We layered a powder of an antibiotic right into the patient's spine. We packed an antibiotic into the patient's spine because we knew that those masks didn't do jack at all to prevent infection. If you want zero infection, Sure, you sterile precautions, you gown up, you wash your hands, you wear a mask, but you're packing an antibiotic inside a guy's spine too, because you don't want a bad outcome there. So masks really, really don't do anything if you're really trying to prevent an infection. You need a lot more than that. Someone said, you're 100% right. We have a family member in the hospital and can't see her. I said, so critical to have family there. It is daily that I see a patient who has no idea what allergies they have and what medications they take or what diseases they have. That's so true. Even unfortunately here at Iron DPC, I really want patients, when you come to see me, don't tell me it's that blue pill that you have me take. I'm like, oh, please, I have 600 patients. Okay, we have like 1,200 patients at the practice. I know a lot of patients. I know you, but yes, I may know what you're taking. I see it in front of me, but I want you to know what medications you're taking. I don't want your wife to know. I don't want your boyfriend to know for you. I want you to know. I want you to know why you're taking it, what it does for you, and I want you to be mindful of the side effects that we could potentially have and the benefits it can potentially have. I want you to know everything about this drug that you're taking. Everybody needs to know everything about every supplement they're taking and every drug that they're taking, right? And when I'm asking you what medicines you're taking, it's not so much for my knowledge, it's for me to understand that the patient understands what they're taking and why they're taking it, right? It's a process of educating the patients. Sometimes if you're demented, you need someone to be there and recite to me what they're taking. But if you're not Alzheimer's dementia, you should know what you're taking and why you're taking it. The drug allergy disease interactions gets complex quickly, especially with conventional medications. Only the family members sitting there know in the corner what the patient's taking, especially if they're really out of it and they're sick, they don't know what they're taking. Medications are so dangerous, it takes a whole team not to mess it up. Yeah, that's true, especially in the hospital. There's a lot of drugs. So you need they'll have the pharmacist check, they'll have the nurse check, make sure that the patient is being given the right medication. And then the physician signs off on it, the PA signs off it in the hospital, they order it, and then there's a whole process of people checking it. So yeah, you need people in the hospital. It's so stupid not to allow family members. And again, it was the managerial state flexing their managerial powers, these damn bureaucrats. Melatonin for COVID-19. Very early 2020, I was reading what other smart people, I think Eddie Joe, MD, was fairly smart back then. He wasn't pushing the vaccine so much because remember, early July 2020, there was no vaccine. So really cool ICU doctors like Eddie Joe, MD, they were researching what other European, Chinese, Turkey, what they were doing for their patients, looking at repurposing known drugs that we currently have available and applying it to the sick patients in the hospital setting. So this is a really cool time, really inspiring time for mainstream medicine because they were actually practicing like functional medicine, repurposing drugs, looking at the mechanism of action, pathogenicity, and trying to help patients. So there's some really bright people out there. Had a 60-year-old male with hypertension on an ACE, which is an angiotensin. It's an ACE inhibitor. It's a lisinopril medication, right? Coming to me with a COVID, O2, 90% lungs with severe bronchi 4 days ago. Just called him, doing better with my regimen. So I was using early treatment, repurposed drugs, early multi-drug protocol. That's funny. I don't know how I did that. Controversial opinion. COVID is a first world problem. That's why it receives so much attention. Yeah, Africa really didn't have a big deal with it. What would I do if I caught COVID or a virus or an illness? If I caught Corona, I would stop all junk foods immediately that cause glycemic spikes. It would just be fish and meats, basically, complex carbohydrates, because food is a treatment for COVID-19. And I had young MDs and PAs unfriend me for posting this. Eddie Joe, back again. We spend so much taxpayer money on NIH funding, $40 billion, but have a paucity of studies for outpatient COVID therapy. We're 8 months into pandemic, Time for facilities getting that fat check to step up their game. Yep. The amount of money sloshing around was absurd. All these academic centers making so much money every time they diagnosed a patient with COVID, and every day they had a COVID patient in the hospital. What were they doing? Right? But they didn't have a functional brain. They didn't have a functional mindset. They didn't know, oh, well, we're just going to wait till the CDC. It's so silly. But Eddie Joe, he was kind of cool back then. When the mandates are not about health, what they mandate when they pretend to care about people. Forced vax regardless of medical status. What I would look like if they cared about people. What it would look like if they really cared about people. Natural, active immunity encouraged. So what does that actually mean? Because we hear that from functional medicine people. So that means optimizing all hormones. If we improve a patient's DHEA, they have less illness. Same with growth hormone. If we optimize their estradiol in women, it modifies their inflammatory response to things. If we give them progesterone at night, women are sleeping again. If we optimize a male's testosterone, it decreases their visceral fat. It improves their muscle mass. It also modifies cytokine reactions. Hormones are immune modulatory. That's why when I have an autoimmune patient come to the practice here, I look at their hormones first. In some patients, they want a conventional diagnosis. They want to get the correct lupus antibodies. Yes, that's okay. But you have symptoms. You have maybe one marker for lupus, and I see a DHEA that's low. We're correcting that DHEA. We're optimizing your hormones already. We don't wait for a diagnosis of lupus. That is a conventional mindset because you want to get insurance approval for the disease-modifying agent that's specifically FDA approved for lupus, so you have to make that diagnosis. That's not what we do here at Iron DPC, or, I shouldn't speak for other functional medicine practices. We look at the patient, the symptoms. We look at the fundamentals, which is hormones, right? HRT for men, HRT for women. That's the basics of functional medicine as it should be. You optimize those hormones. You look at the diet. That's next, right? Junk food, eliminate those, sugars, oils, whole foods diet. And then last, we look at gut microbiome. We look at gut permeability. We try to fix the gut. It's a stepwise process here. We fix the nutrients, micronutrients. Instead of mandatory mask wearing, which they're still pushing in all educational programs across the U.S., if you want a professional degree, if you want to do a clinical rotation, they're still forcing masks on people, which they shouldn't be doing. It's not legal. What we should be doing instead, if you're sick, take some hydroxychloroquine, zinc, vitamin C. We have a lot of things we use. We have peptides. We have herbal medicines we use. Exercise. When you have a robust musculoskeletal system, it's disease modifying. It modifies your cytokine response to the illness. So you're not as sick. I tell you, the patients that come to me who chronically have an illness, every time we have another flu or COVID wave, they're not metabolically healthy. They don't have muscle mass. They're not lean. They have a lot of visceral fat on their abdomen. They have a heightened immune response to the antigen, right? It's not the disease itself that makes people sick. It's people's inflammatory response to the illness that makes them sick. It's their baseline hormones, their baseline nutrient status, their gut permeability, their stress. This is what creates the illness. It's not the pathogen itself. Importance of sunlight exposure, getting sun on your skin. Stop lathering yourself with chemicals, hiding from the sun. And then, of course, toxins, the toxic household, the VOCs. We've given podcasts on VOCs. We've given talks on mold and mycotoxins, how to assess for these in your home, how to get rid of toxic airs. Those are the things that we should be talking about rather than forcing masks and vaccines on everybody. Wow, I look young. Look at that. Not sure how this is circulating around, but I've seen it one too many times. Treating COVID-19 with around-the-clock Tylenol and ibuprofen, it does not help. It burdens your livers and kidneys. They shouldn't be doing that. And I don't know, I've been out of the conventional game for some time now, so I'll get on occasion a patient who's still taking ibuprofen. Actually, I had one today. Usually not my patients. I usually know better than taking ibuprofen and Tylenol for a COVID or a cold illness. But no, we don't use these. If you take Tylenol, it depletes you of glutathione, burdens your liver. What do you need glutathione for? It's your master antioxidant. You burn up glutathione when you're sick with COVID. I studied that early on in the pandemic. Polnikov et al. In Russia were doing IV infusions of glutathione for acute COVID illness in the ICU and having good results with it and demonstrating modification of the cytokine profile. So don't take Tylenol, and then don't take ibuprofen. It destroys your kidneys. It gives you acid reflux because it burns holes in your stomach, and it delays muscle synthesis. Yes, it blunts prostaglandins, so it makes you feel better temporarily, but it is a problem, and too many people are using it for chronic pain as well. If you have chronic pain, don't use ibuprofen. Come to Iron DPC. We figure it out. Had to tell someone today who has been taking 1 gram of Tylenol every 4 to 6 hours for 10 days that they need to stop that. So that's about 40,000 milligrams of Tylenol. Who keeps telling people to do that? Are you going to a mainstream medicine doctor who tells you to take Tylenol? Fire them immediately. They're not worth their salt. Also in COVID news, the recovery trial has proven that hydroxychloroquine doesn't matter, wait for it, once the patient is very sick in the hospital. Little has been shown to help at that point, except maybe dexamethasone, which was a positive study in the recovery trial. So far, there is no study in the outpatient setting that proves or disproves that early use of hydroxychloroquine and or azithromycin prevents admission to ICU. All that was shown so far is that they decrease time to retest negative. Gautret et al. And Million et al. Take that endpoint for what it is. That's a stupid-ass endpoint. Right? Testing negative for COVID, who cares? Here it is. We were just talking about some of this. These are cytokine storm and how you can modify this, the ACE, the renin, the system. If you really want to go down the rabbit hole of COVID mechanism and potential treatments, read this article. Well done to the authors. And then glutathione, how glutathione is very important for treating patients who are sick with acute cytokine storm. They burn through their glutathione. I love this guy. This was a Tillis gym in New Jersey. I followed these guys standing up to Governor Murphy, absolute tyrant, right? So a form of actually, so when the foxes, this is the soft tyranny, when they start to exert a lion-type tyranny, which we saw in the Soviet Union, where they go in and they actually restrict people when they start to arrest people, or in this case, a Tillis gym, they board up the gym. They don't do it right, so they're not very good at hard tyranny, and so they botch it typically, and usually it just empowers people, right? Which is a good thing in our case. It looks like we're going to Walgreens here, who told us to mask. Coca-Cola, 3 for $12. That's for your health. That's Walgreens for you. I hate Walgreens. Please don't ask me to send prescriptions to Walgreens, CVS, or Publix. I hate commercial pharmacies because they declined to fill prescriptions for hydroxychloroquine if they thought I was going to prescribe it for COVID during the pandemic. These were professionals, medical professionals, pharmacists who worked at these big box pharmacies. And if they thought, so hydroxychloroquine, mind you, it's used for lupus, it's used for arthritis. That's, typically prescribed in 90-day supplies or 180-day supplies. But if it looked like I was prescribing it for like a 7 or a 10-day protocol for what would be potentially COVID, they would report me to my supervisors and say, this guy looks like he's prescribing it for COVID. Can you do something about him? They're trying to get me fired. Unbelievable. I remember when Nancy Pelosi went to go to a nail salon and took off her masks. Yeah, there she is. By now, everyone has heard the 6% thing from the CDC. If you've been paying attention to what I've been saying, I was trying to bring this attention. I don't know what the 6% thing is. Just that one. All right, next. Closing thoughts on COVID-19 mortality. Mortality data from COVID-19 is from all-cause mortality. Shock is an important cause of mortality. Detection bias cannot be understated. The data of positive cases and deaths used by the WHO and CDC is from patients who are suspected of having COVID-19, not universal sampling. CFR may be much different. That's case fatality ratio. Case fatality ratio is much higher in critically ill patients, i.e. shock. This may seem obvious, but it is important to consider when analyzing hospitalized patient data, as can be seen from the high CFR of hospitalized pneumonia patients. There is no current literature evidence that COVID-19 kills pediatrics. The rate of death in individuals without comorbidities is statistically insignificant. Ooh, that's triggering. CFR from influenza is less than COVID. CFR from all-cause pneumonia in hospitalized patients is greater than COVID. So number one, mortality has always been counted as all-cause mortality. Number 6, the death rate from COVID-19 in those without comorbid conditions is not statistically significant. So the 6% death rate, without comorbid conditions related to COVID-19 should come as no surprise. So if you test only the patients with the illness in the hospital, you get a higher case fatality ratio. If you test everybody in a population and see who dies there, the fatality ratio is much less. So this was a way they manipulated fear in people to exert tyranny, right? Clever. And this was what I was assessing early on and publishing on my social media, which was Iron Physician Assistant at the time. Venous thromboembolism and acute coronary syndrome are important cause of death in COVID-19 in those with predisposing risk factors for CAD. Prophylaxis against ACS and VTE must be considered because they likely contribute to a significant portion of mortality that is not being categorized. It just makes sense, right? You have a massive cytokine storm, which we understand, and you have somebody with maybe some atherosclerosis at baseline. Those two will put them at risk for clots, heart attack, strokes, death. So what I was doing in the urgent care is I was putting people on blood thinners who had those risk factors. At least an aspirin. Oftentimes I would prescribe a Plavix. And in some cases, I was even prescribing Eliquis or Xarelto for the duration of their COVID. I mean, pretty ballsy. I don't know anybody else doing that at the time. But I was throwing the kitchen sink at these people. Unfortunately, when I spoke to researchers looking at ACS-VTE phenomena, they admitted that no autopsies were being done and that COVID death, despite being often related to VTE or ACS, was lumped as all-cause mortality. Why this is the case is beyond me. I have to select the most accurate ICD-10 code for everything. If I write ankle sprain as a diagnosis, the code won't be accepted by insurance. I have to instead write S93.422A, sprain of the deltoid ligament of the left ankle initial encounter. How come deaths for COVID aren't specific, such as COVID-19 deaths secondary to ACS of the LAD resulting in CHF? Well, that would be specific, but they weren't doing this. I don't know why. I asked the researchers. I mean, you can actually email researchers oftentimes. These are usually like people, they don't get paid much and they're kind of bored and they're kind of happy if someone pays their research a little bit of attention. So you can write to these people and they'll reply often. I loved Lockdown TV. These guys were really smart, talking about Sweden, what Sweden was doing at the time. They weren't locking down their populations. Really liked these guys, what they're talking about. What is this? On the topic of government playing at medicine, i.e. playing folic acid and everything, but I think it's a good idea. Government's usually wrong. Whenever I discuss EBM, evidence-based medicine, with lay people who demand quarantine and mask enforcement from our government, I try to explain to them, but they don't seem to understand. Yeah, there's no evidence-based medicine at the time in July of 2020. There was none. They was all, I mean, I'm okay with practicing functional medicine, right? You go path mechanism of action, you apply it to the patient, you see a result, you see if it works or not. It's very precise and individualized. When you're applying that to a population at large based off no evidence, you can't do that, right? It needs to be either super individualized for the patient, right? Okay, this patient needs a mask because X, Y, Z. We don't have any evidence to back that up. The evidence is maybe a little bit flawed. It may be based off mechanistic studies. Okay, but it's to this patient. You can't require this across the board and claim evidence-based medicine. It's nuts. Ask 10 providers how to interpret any certain EKG, and you'll likely get 10 different answers. Yeah, doctors have their own way of interpreting EKGs, their own art to it. Yeah, they make some variation of a similar response, but they might find different responses in it. That's the art of medicine. And that's what I think gets lost a lot of the time. People, government, and some providers fail to recognize how imprecise medicine is and how enforcing medicine through policy will invariably end up being on the wrong side of history, since medicine always changes with new evidence. Just take estrogen, for example. They looked at the Women's Health Initiative again back in 2018. They was like, oh, wait, we've been wrong for the past 60 years. Estrogen is actually really good for women, and it doesn't cause strokes, heart attacks, death, and cancers. It actually prevents those sort of things. Oops. Sorry. So that changed. And now we have to undo 50 years plus of estrogen bad, hormones are bad. And just JAMA came out and published on Facebook today how osteoporosis is a problem, yes, but they forgot hormones. They talk about bisphosphonates. They talk about synthetic disease-modifying agents. They forgot hormones. They left it out. They omitted it completely. They were like, well, menopause is, you see an increase in osteoporosis, menopause. Forgot hormones completely. That's just JAMA. That's supposed to be like the gospel. This is the food pyramid brought to you by our government that brings us forced mass and unscientific shutdowns. Let's see what people think about the pyramid you were taught in school, created by the USDA. Helpful or harmful? People thought it was harmful. These are the people following me. If government actually cared about the health of the people, they would make NAFLD a priority, which is non-alcoholic fatty liver disease, which they've now changed the name on it. I forget the name. It's always been NAFLD to me because that's what I did research on it in college. Keep lockdowns, masks going till a vaccine comes out. Give more money to pharma to create a COVID pill. Yeah, you know what they did. You've never heard of non-alcoholic fatty liver disease. Yes, it's growing. It's the number one reason for liver transplantation. Children have it now. About 30% of the general population has it. Every time I see a MRI of someone's abdomen, if they're a little bit overweight, they have fatty liver disease. What radiologists don't comment on is visceral fat. So they're missing the mark on that completely. They're not quantifying and giving a percentage of visceral fat in the patient's abdomen. Every patient has visceral fat in their abdomen if they're not, training intensely, eating well, taking the right hormones. They all have visceral fat, and visceral fat causes cancer and heart disease. But no one's paying attention to that, and radiologists ignore it completely. They'll comment on the fatty liver disease, but they'll miss the mark on the visceral fat, or they'll say it's a normal abdomen, completely normal, because they're looking for tumors and something like that. But the patient's full of fat. Comment on that. Come on, radiologists, wake up. People are dying because of that. Oh, my abdomen's normal. The radiologist said so. No, you're fat. You're full of fat. There is better data on living well to 150 than there is to support mask wearing in public. That's NAD discussion. So NAD levels decline with age, and there's a variety of ways to increase NAD. We do precursor supplementation with True Niagen's nicotinamide riboside or Quicksilver Scientific's and our precursors, and we get great results on that. Some patients with low NAD feel great. How do you diagnose low NAD? There's not a really good test. I think True Niagen is coming out with intracellular NAD testing right now. What I do is I give them an IV of NR in a patient where I've checked off the box on everything else in chronic fatigue, give them an IV of NR. If the patient does well and says, wow, I feel like a light bulb turned on, they were NAD deficient, give them NR. If nothing happens or they feel jittery or like a little anxious from it, it was too much, they didn't need NR or NAD. There's more evidence that reversal of aging is more real than the evidence for government-mandated social distancing and quarantine of the healthy. So back in 2020, I already knew I needed to be here. I needed to be doing anti-aging medicine. Oh, look at that. 7 months into the reduce the spread in 15, so hospitals aren't overwhelmed. This was in Davie, I remember this. This was Davie, South Florida. I was down there visiting my buddy Josh, and they had closed off the playground for health. Can you believe that? This is an outdoor gym in the sunlight that they closed off for health. These scum, these totalitarian managerial state scum, oftentimes are still in office. When you see these people running for the midterms, hold them accountable. Where were you in the pandemic? What was your stance? Did you support lockdowns, locking down playgrounds, masking people, shutting down businesses, forcing vaccines on people? Hold them accountable. Find out where they were. Look in their Instagram and Twitter history. Hold these people accountable. Hold their feet to the fire. I don't want any of these people in positions of power. If you were a totalitarian managerial state bureaucrat back in 2020, do you think you changed now? Did you change your ways? I doubt it. If you're reading this, it means you haven't unfollowed me due to my stances, that the response of COVID has been more damaging than disease itself. If you still have doubts, you must listen to this podcast from ZDog MD. That's ZDog. I don't listen to him anymore. I listened to him back then. He was a little bit cool, but I think he became pretty pro-vax at one point. CDC now says it's not airborne spread, but rather droplets. Yeah, there was a lot of goalpost moving, and that's what they do in the managerial state. Apparently, NASA states that there's a 0.41% chance that an asteroid will hit Earth in November. That's a lot higher chance than dying from COVID. Using government interventionist logic, we should send Bruce Willis and a team into space to drill a hole through an asteroid and nuke it from the inside. You ever watched the movie Armageddon? It's a classic. Learning Dirty Genes. One of the first books I read on functional medicine by Ben Lynch, a naturopath. Love that one. Yeah. Ben Lynch. I forget what he's doing these days. I think he's against iodine. Ooh, DeSantis. What was DeSantis up to? Yes, he was lifting coronavirus restrictions. Finally. Took him long enough. What is Eddie Joe on about? Can't read that. One of the biggest pro-shutdown arguments I encounter is that saving lives through shutdown is worth the economic damage it causes to people and businesses. These people clearly skip the days in PA school where I learned about many diseases of poverty and that the number one indicator of any country's low mortality rate is a good economy. Yeah. We must reevaluate this shutdown and living in fear scenario. Take a hard look at what politicians playing at medicine have done to this country in the name of health. The knee-jerk, empathetic reaction to save every life, no matter the cost, is harmful. Yeah, sometimes these people have too much empathy, too much sympathy, and they don't know how to think logically anymore. Governors and mayors shutting down the country to treat disease is a medical intervention. I'd say yes. That's what it is. I don't know about you, but I was trained to weigh the risk-benefit of every intervention. Shutting down the economy without considering the side effects would be like prescribing Zosyn and vancomycin for every cough that came into an urgent care. They kind of do that in the hospital, though, for certain patients. You know, if a diabetic with a cough or pneumonia, or even like a bronchitis, that maybe you can make the cases if it's pneumonia, they get vancomycin and blood cultures every time. Sure, you would never miss a bacterial pneumonia, would save lives in 1% of the patients who actually needed that. Meanwhile, the other 99% would have their microbiome destroyed. You'd injure kidneys, cause Stevens-Johnson, Redman syndromes, you'd cause arrhythmia, C. diff, anaphylaxis, and accelerate the real pandemic of bacterial resistance. The term is antibiotic stewardship. It means using antibiotics prudently so that you don't harm the individual and don't harm the population with antibiotic resistance. As Americans, we love intervention, be it wars or medicine. We must start realizing this and seeing how harmful it is. I think I just invented the term intervention stewardship. You hear it for the first time from Sturf. You can quote me on that. Intervention stewardship. I like that one. Forgot I coined that. New data from the CDC on COVID mortality. 0 to 19 years old death rate is 0.003% or 0.000, that's 4 O's, 3. So that's 268 weeks ago. That's probably like August 2020. 20 to 49-year-old death rate is 0.02% or 0.0002. And then the 70-year-old or older death rate is 5.4% or 0.054. Let's compare this. So I did a comparison. In perspective, the 2018-2019 flu positive patient death. Hospitalized patients with other diseases for which we actually have therapeutics have much higher hospital mortality rates. A sane person would say, let's quarantine the age 65 plus year population. With telehealth, Uber Eats, and Amazon Prime and PJ's delivery, there is no need for them to venture outside the house at all. But no, the conclusion our officials drew from this and continue to draw is, let's shut down gyms and parks because 70-year-olds love monkey bars. What? And that was the COVID-19. But we were comparing the flu positive deaths, which is very tiny here. Maybe I can read it. During September 30th, 2018 to 2019, 116 laboratory confirmed influenza-associated pediatric deaths were reported to the CDC. 66% children died after hospital admission to the hospital. Among the 104 children with a known medical history, 51% had at least one underlying medical condition. But that was a China study. China studies are oftentimes kind of junk. Using data available from October 2018 to 2019, CDC estimates the influenza virus infection has caused 37 million to 42 million symptomatic illnesses, 17.3 million to 20 million medical visits, and 530,000 to 647,000 hospitalizations, and 36,000 to 61,000 deaths in the United States. Well, probably all comorbid. And that's why it also bugs me, this campaign to get a flu shot in everybody's arm. No talk about DHEA, vitamins, early treatment with methylene blue, ivermectin, inhaled steroids, 20% acetylcysteine solution via nebulization. No talk about that. No talk about gut microbiome. Nothing. Just everybody gets a flu shot. No matter who you are, everybody needs it. Prevents death. What? I haven't taken a flu shot in years. I don't get sick anymore because of it. The last time I got sick, I took a flu shot. I had flu A. I know this because I was working in urgent care. I felt pretty crummy, like I just worked out really hard and I didn't work out. Took the flu test. I was flu A positive. I took a flu shot because I wanted to get the job. Stupid. You know, you can do anything when you're broke and have a bunch of student loans to pay off. The president is following my COVID-19 supplement plan. With the science behind why. Okay, zinc, vitamin D, melatonin, aspirin. And I say I'd add glutathione and high-dose vitamin C as well. Would also recommend a carnivore-based diet and daily walks in the sun to improve glycemic variability. I'm not sure about the monoclonal antibodies. Yeah, I didn't know about it. That was pretty cutting-edge stuff back then. Okay. Inovio COVID-19 vaccine trial placed on hold after FDA questions. There wasn't much questions. Whichever vaccine company gets the vaccine is going to make billions off of all the people lining up to get it. The MSM has done a good job of running a year-long fear advertisement for pharma with no commercial break other than regular reminders that Orange Man bad. This is 2020. That's right. We had Trump in office. Great time. Great time. Trying to get a global pandemic under control without talking about diet and lifestyle. We have a guy bailing water over a fence, even though it's flooding on both sides of the fence. Cool. Yeah, it's Trump here. Great to know that I have been doing some of the same low-cost interventions for my COVID patients as one of the finest hospitals in the world is doing for POTUS. Interestingly, that I've even received pushback from peers for what I've been doing. Let's review some of the things I've been using that the president has been treated with. And I bring back one of my things that I published back in early April. I suggested cardiovascular and VTE prophylaxis. The president's taking aspirin. Here's my slide on anticoagulation and why you would want to do that. Aspirin is a cheap antiplatelet. For mild cases Trump has, it should be adequate. For more severe cases, a proper anticoagulant should be considered like Xarelto or low molecular weight heparin in the hospital. That you can prescribe heparin outpatient. If they just inject it themselves, that's all. Not hard. Fairly safe too. Zinc. Trump is being treated with zinc. And I actually still have this lecture up on my old YouTube channel of the early treatment. Trump is being treated with zinc. There are many physiological, mechanistic pathways to support taking zinc in COVID and other viral and bacterial illnesses. I don't recommend just taking zinc long-term. It's used acutely for an illness. It does have some viral inhibitory properties. Melatonin is an antioxidant, anti-inflammatory, very important for sleep. It was used in high doses in ICU settings, 50 to like 200 milligrams in some settings, crazy doses. I started giving this to patients as well in the outpatient setting in urgent cares. Vitamin D, Trump is also taking that at that time. Most every patient is vitamin D deficient. So I would load patients up on heavy duty vitamin D, at least 10,000 units a day. There's some prescription availables. You could get 50,000 units. So I was dispensing and prescribing that for these patients. You know, there were some real incels I was seeing in the urgent care. These people didn't see the sunlight. You can see it in their skin. You ask them, like, how often do you see the sun? And they like look at you with that sheepish grin. Not much. So I would prescribe them 50,000 unit ergocalciferol, plus some K2. Glutathione. Unfortunately, Trump didn't know about glutathione. He didn't come to my urgent care. Otherwise, I would have told him to take some. He could still watch my YouTube video, though, and learn about the benefits of NAD plus arginine. I didn't know about Berkeley Life nitric oxide back then. Arginine was the closest I could get to nitric oxide precursors. But now we sell Berkeley Life potassium nitrite. It works way more efficiently than trying to take citrulline or arginine. And a lower carbohydrate carnivore-ish diet, so a high omega-3 ideally, that'd be best. But conventional medical professionals never counsel on diet and supplementation. They are critical of any supplement. They think it's, I don't know, fakery. You're trying to sell something. I didn't sell anything. I was working in urgent care. I printed out a list of supplements patients needed to get, and I said, buy it. And they're like, where am I supposed to find this? And I didn't know about FullScript at the time. I didn't have any recommendation. I didn't go to any of these A4M events. I don't know, Amazon, Walmart. I don't recommend Amazon anymore because there's too many fakes. And Walmart has a lot of junk products as well. But yeah, I was using supplements back then in urgent care, just giving people lists. I printed out lists and I would hand out hundreds of these things. Here's a picture of our Trump, our president. He beat COVID. He's all right. There is a treatment for COVID. It's ready to be available, and it's mostly lifestyle based. Now to the caveat about supplementation before everyone starts supplementing with zinc. Yes, so you can mess up your copper to zinc ratio if you take too much. And some people, and I didn't know this back then, why it makes expensive urine. Some people don't absorb capsule-based vitamins appropriately. Liposomal formulations, which I already knew about back then, they have much better bioavailability. So we use Quicksilver Scientific here. Fantastic bioavailability. Bypasses the digestive system, gets right into the bloodstream, has a quicker effect. Plus, if you have leaky gut syndrome, taking a capsule-based vitamin doesn't work so well. So at the practice here, we must start people on a capsule-based vitamin because they're cheap, they're easy to take. But you test their micronutrients. Oftentimes, they're not absorbing it, fortunately. You can do IV vitamins. It's a very powerful tool. You give it an acute illness. I love it. As for like a nutritional replacement therapy, ideally just eat good food and take vitamins that you can actually absorb. But sometimes, it helps people feel better. And, they can't eat well. And there's a lot of reasons, like IV iron, sucrose. I mean, that's an exceptional product that we give to iron deficient women here at the practice at Iron DPC to help correct iron deficiency anemia. And it works rapidly. And their symptoms resolve almost instantaneously. Like within a day or two, I'll get text saying, hey, I feel so much better. My anxiety is better. My palpitations going away. I don't have dyspnea anymore. Like this happens within a week sometimes, which is like crazy to think about because it's not like they produce more red blood cells within a week, but the iron itself helped them feel better. Back then, I really liked beef liver and organ meats. I still do. I still eat them on occasion. I think Logan's going to make some for Thanksgiving, actually. We can make some beef liver pate. I remember this. A reminder that the Miami mayor closed down South Beach Gym, the open air sand beach. Just insane. When are these politicians going to be held accountable? I would like to see the people in the pandemic who hid behind, oh, we're just following the CDC. I would like to see them held accountable, serve jail time. Like these scum. These people are scum. They should never hold any authority over any other human ever. Never. They should be doing menial jobs where it's just sweeping roads, okay? These people are scum. Whoever did this, who shut down an open air gym, is less than scum. Official Office of the Governor of California. Going out to eat with members of your household this weekend, don't forget to keep your mask on in between bites. You remember that? You remember how stupid that was? This was real stuff, and you would see this in real life, actually. Like, we're going to tell our kids about this one day. How we'd see people in the cafeteria at the hospital, or there weren't so many people going out to eat. Actually, there were, and you would see them wear masks and put food in their mouth and put the mask on, alone at a table. Like, people were so brain dead. Worm in the brain, brain dead. Okay, Metabolic Mike. What do you say? Lockdowns make you unhealthy, more vulnerable to future infections. Metabolic Mike. Yeah. I remember that. Stay home with your sick family members. Listen to a lawyer talk about how many states, especially Democrat-controlled ones, actually have surprisingly large power to enforce vaccine mandates. First step was mask mandates and gym shutdowns. We meekly went along with it. Next will be vaccine mandates. Let's see what medical professionals think about that. Yeah, I was already predicting vaccine mandates. What does this NP say? Kimberly given agree 100%. Most vaccines take several years to move through FDA required approval. In no way do I feel comfortable having this vaccine administered without knowing the true safety of it and long-term side effect profile. I too am pro-vaccination. I guarantee you this nurse practitioner took the vaccine the moment it came out. Like, a lot of these people were big talk because they were anti-Trump and it was a Trump vaccine. But then once they forgot and the Trump was out of office, they were lining up and coercing their patients to take this unproven experiment. New York Post. We in the World Health Organization do not advocate lockdowns as the primary means of control of the virus, Nabarro said. That Nabarro is an envoy of the WHO. Okay. Yeah, they were moving their goalposts and changing their minds all the time. But people would hide behind WHO and CDC. They still do to this day, as if there's some all-knowing authority. What are they doing now that RFK is in office and he's saying stuff that's anti-vaccine? Are they still going to hide behind the skirts of the CDC guidelines? I'd really like to know. I'd like to meet these people. Or we did meet one today, and they still quoted CDC at me. I'm like, I was too flabbergasted to even point that out. Let's see, what is this? Other studies have estimated attributable fractions for mortality of 2% to 6% for poverty, depending on the year and data source, 9% to 25% for income inequality, depending on age group, and 18% to 25% for low neighborhood socioeconomic status. What are we talking about here? I'm not sure. There will always be those who think government intervention is correct. I came from a long line of government dissidents. My family on both sides, Germany and US, always subverted authoritarianism and totalitarianism. Yes. The Great Barrington Declaration, which I signed. As infectious disease epidemiologists and public health scientists, we have grave concerns about the damaging physical and mental impacts of prevailing COVID-19 policies and recommend an approach we call focused protection. I wonder whatever happened to this. This is a case example. I saw in the urgent care. Excellent case example of COVID lockdowns harming the exact comorbid persons it intended to save. So this hypertensive diabetic patient had lost her health insurance due to job loss from the lockdown COVID interventions. She'd been on metformin, 1,000 milligrams BID, Jardiance, and Ozempic. Her diabetes has been out of control and a large cystic abscess formed on her suprapubic area. That happens when you have uncontrolled diabetes. You start getting random infections. I have surgically managed the wound here over the past few days and placed the patient on antibiotics. The wound is improved at follow-up today. She will need diabetic control to provide wound healing. I have started her back on the metformin at her previous dosage. Notably, she has been following a strict low-sodium and vegetarian diet. Guess who taught her that? Some retard primary care. The blood work reveals how this has been harmful to her. She is hyponatremic with a fasting blood sugar of 300 plus. Her creatinine is also low at 0.4, likely from both sarcopenia and low dietary intake. But most primary cares would be very happy to see that diabetic's creatinine wasn't elevated. I advise the patient that vegetarian low-sodium diet is harmful to her. She will try a low-carbohydrate, higher-fat protein diet with added sodium to home-cooked meats. She will avoid vegetable oils and processed foods. Man, you got a real bang for your buck when you saw me at the Discount Urgent Care down on Wickham Road in Melbourne. You got functional medicine, early treatment, surgical management. Like, I was doing everything. Functional medicine, surgery, you name it. And we were always taking a dietary history in an urgent care. Have you ever been asked a dietary history in a random urgent care? No, only with me. Here's Babylon B. Man who agrees with the media, universities, and corporations and Hollywood thinks he's part of the resistance. There's liberals like this. I know some. They don't follow me anymore. Okay, look at this fake news hating on the Great Barrington Declaration. Rolling Stone. Yeah. Berkshire Eagle. Yeah, they hated the bird. There was a lot of signatures on it. There must be 32,000 right-wing conspiracy theorists, medical practitioners in the world, according to the mainstream media. European countries are already being put back into semi-lockdown again since COVID came back. Lockdown didn't eradicate a virus. Shocker, I know. That was 264 weeks ago. Let's see, what was that? 264. Calculate. That was November 2, 2020. Poor Europeans. I can't imagine living in Italy. No going out for cappuccino, pasta, 3-course meal for a couple hours in a restaurant. What did Italians do in COVID? I can't imagine the country. Guardian superior rude to homeopaths. The Great Barrington Declaration, which was said to have been signed by more than 15,000 scientists and medical practitioners around the world, was found by Sky News to contain numerous false names as well as those of several homeopaths. Yeah, they hate homeopaths. They hate PAs too. I mean, the moment you don't have the degree that they associate with authority, like even Carnivore MD, they will call him out as a psychiatrist, even though he has continued education in nutrition and health. Like, what does a psychiatrist know about food? Right? Or they'll say, Sean Baker, what does he know about cardiovascular disease? He's just an orthopod. And of course, they denigrate me for being a PA. I had a mayor of Melbourne Beach tell me that when I brought him all my research against lockdowns. Told him to let people go to the beach and unlock our tennis courts. He's like, what do you know? We follow CDC, and I don't see any credentials to say that you know what you're talking about. You're just a PA. You're just the mayor of Melbourne Beach. Jim Simmons. I'll never forget that. The Wuhan virus pandemic. Found it. Democrats. Racism. Oh, it's a pin in a haystack. A needle in a haystack. They found the racism in the haystack on the Wuhan flu. Me watching all my friends slowly radicalize and start to question where the government gets authority to shut society down overnight. There were some waking up, maybe thanks to some of my posts. Here's a news article. Forced isolation may be the only way to stop resurgence of virus. This is so New Zealand enacting strategic policy successful from Italy to Korea. New Zealand, they like to lock people down. When the media sympathizes with totalitarianism. Yeah, I remember that. Now they're all against totalitarianism. Like, Trump is arresting illegals. It's totalitarian. I remember when they loved totalitarianism. Inside ex-prison camp where Australia's coronavirus evacuees will be quarantined. Australian coronavirus evacuees are due to arrive at the controversial Christmas Island Detention Center today, where they will stay in quarantine for the next 2 weeks. Australia's nuts. Did you know that airsoft isn't illegal? It seems like everywhere they ban airsoft is also kind of a totalitarian state, Germany included. Airsoft is illegal. You can't play it there. Oh, this is a funny meme. So if Instagram, Facebook, and Twitter existed in 1775, they would have flagged Paul Revere's The British Are Coming post as learn how British taxes are beneficial for society. You remember that when they would put those disclaimers at the bottom of a post that were anti-establishment? I mean, Trump was still in that office too. I don't know how they reconciled it. Right? They loved totalitarianism so much that even Trump, who's supposed to be a despot and a tyrant, who's in office, I don't know how they made these logical leaps. I can't. My brain doesn't work like that. Gavin Newsom, he's got a mask in his Twitter profile pic. Due to the alarming increases we are seeing in COVID-19 cases, California is pulling an emergency brake. To slow the spread, 41 counties, 94% of California's population, will now be in purple, the most restrictive tier. Never forget. And then given us some next picture, he's unmasked at a nice dinner with about 1, 2, 3, 4, 5, 6, 7, 8, 9 people in a close circle at a table. Incredible. Time to fire Fauci, this post says. Your voice matters. Add your name to the petition. Not enough. He needs to go to jail. He's still not in jail. Another news article. Can you explain to me how these liberal states with the strictest mask wearing and lockdowns and gym closures now have an increased rise of COVID? No, but I have some theories. I forget my theories were. What are they? It's the age-old question. Why does flu season exist at all? Is flu airborne? Is flu airborne and travels through the atmosphere every year, freshly mutated from China? Oh yeah, that's the theory, right? It's so weird to think about that, right? Are viruses more prevalent because people are spending more time indoors, as is commonly taught as a reason for more URI illness in winter in medical programs? That is the common teaching, all right? An immune-based perspective might give us a more intelligent insight into why. It is clear now how those with low vitamin D suffer more with COVID. Winter may also mean people are getting less exercise as well as less sun. Perhaps a weaker immune system is what causes more viral infections. Ooh, terrain theory, that's controversial. These viral illnesses, flu, rhinovirus, even COVID at this point are already within us, just waiting to manifest themselves when our immune system weakens. Similar to how bacterial fungal illnesses represented by strep H, flu, pneumococcus, staph, candida cause illnesses when someone's immune system weakens or there is a break in the physical layers of immunity, such as our skin. These pathogens are already inside us. Why must we assume the viruses are not already within us and simply dormant? I mean, that's also a red pill for functional medicine as well, right? But we go back to conventional medicine, and we know that if you test about 100 patients' throat for strep, you'll find strep in, I think, like 19%. They harbor strep. They don't have symptoms. Same thing if you test your skin. There's microbes on the skin. Your urine, if your urine is sterile, but you have a patient go to the lab and they do a urine catch and they didn't wipe correctly and they didn't do a midstream catch, there will be pathogens in the urine, right? But that's normal. We know that there's pathogens down there. What happens? Why do people get UTIs? There's a lot of reasons. There can be poor diet, not drinking enough water, alcohol, and then disruption of the vaginal microbiome. If it's for women, men don't really get UTIs that much. So unless they're older men and they have prostatitis and prostate, that's another question, another whole can of worms there. Right? And so we also iodine. I think iodine deficiency increases UTIs because I have patients who are now on chronic iodine therapy and it prevents them from getting recurrent UTIs because iodine is an antimicrobial naturally and it's concentrated in the urine and eliminated. But then in functional medicine, the red pill there is if you test patients that are perfectly healthy, they don't have symptoms for Lyme, for mold, maybe they're fine. They don't have symptoms. Like for example, myself, I've tested positive for a variety of pathogens. I have positive blood IgG to cytomegalovirus, to Acinetobacter, and to mycotoxins. Right? I'm exposed to them. I did remediate my house. I tried to cleaned out all the ducts, got new ducts replaced, got a new AC, got dehumidifiers, got a UV light installed. I got my ceilings repaired. I put on a $30,000 new roof. I did a lot of things to fix the mold, but I didn't know I really had it until I did the test. But my theory is that because I take hormones, I take vitamins, I keep a lean muscular physique, I get a ton of exercise, I keep my vitamin D high, I don't become symptomatic. I don't have the symptoms of mold illness, which is what? Brain fog, fatigue, chronic pain, you name it. Mycotoxin illness is the whole spectrum. I did have low thyroid function, but I didn't even notice it until I did lab markers. Low thyroid function is another sign of stealth infections. But yeah, that's the black pill too for the functional medicine community. That stealth infections don't really cause the disease. It's your own baseline health that does. Right? I eat really clean too. MedRx, this is a study, a randomized trial of COVID-19 transmission in training facilities. Listen to the science, they say. Just not this kind of science. So soy politicians continue to make excuses for people to skip leg day. I don't know what the study said. Oh, here it goes. We randomized members aged 18 to 64 without relevant comorbidities at 5 training facilities in Oslo, Norway, to assess or to access or no access to their facilities. Facilities opened May 22nd, 2020 for training arm, applying physical distancing, 1 meter for floor exercises, 2 meters for high-intensity classes, and enhanced hand and surface hygiene. We compared SARS-CoV-2 RNA status by self-administered nasopharyngeal and sputum sampling after 14 days, clinical disease through electronic patient records after 21 days, and SARS-CoV-2 antibody status by dried blood self-sampling after 1 month. Findings: 3,764 individuals were randomized, 1,896 in the training and 1,868 in the no training arm. In the training arm, 81% trained at least once, and 38.5% trained greater than 6 times. Of the 3,000 individuals who returned the SARS tests, 80.5% there was one positive test. The positive individual was randomized to training but had not used the training facility, and the workplace was identified as transmission source. There were no outpatient visits or hospitalizations due to COVID-19 in either group. 11 individuals in the training arm, 0.8% of tested, and 27 in the no training arm tested positive for SARS-CoV-2. So it doesn't seem to matter too much, that social distancing and cleaning. Oh, this poor guy. He was in the middle of an anti-COVID lockdown live stream, and the police showed up, masks in place, guns drawn, to arrest him. So sad. Wow, cool haircut. This is me. In Germany, homeschooling is illegal, a crime punishable by fines on the parents and jail time. Children have been known to be forcibly taken from homes by police, like you just saw. Me and my siblings were homeschooled in Germany during the time we lived in Berlin for 4 years. We broke the law every single day because unjust laws are meant to be broken. Perhaps you now understand why I have such a healthy distrust for authoritarianism. Socialism sucks. Do you live in a blue state that still enforces quarantines at a population level? Well, your governor is still using that old modeling analysis that got us into this mess based off data from cruise ships and Asian metropolises. That's nuts and true. Fact check me on that. That's how they invented the quarantine policies off of Asian metropolises and cruise ship transmission of viruses, and apply that to suburban America. You kidding me? Okay, that's enough for Scamdemic Part 3. That was July to about November, December of 2020. I hope you guys enjoyed this. It'll be up on Rumble. Maybe I'll try YouTube. We'll see how it goes. See if I get shadow banned or blocked or taken down entirely. It'll be up on Spotify too. Subscribe to them all. See you in the next show.